One dilemma facing rehab is how do you work the muscles around an injured area? Well, science has helped us find a way. Salina Regional Physical Therapist Jordan Zuccarelli talks about blood flow restriction training today on The Pulse. Jordan, I had mentioned it in the opening, so you have a patient with an injured knee, you really need to build the muscle mass. How do you do that?
So this is something that physical therapists as rehab specialists help patients navigate every day.
Okay.
One of the challenges is sometimes it's very difficult to use the muscles in the appropriate way to truly build up muscle strength. One of the ways that we are able to do that now is with blood flow restriction training. This is a way that we can put some restrictive bands around the leg or arm, and they're sort of similar to like a blood pressure cuff, and we can increase the pressure with the band and then effectively trick the body into thinking it's working against a heavier resistance than it truly is.
You mentioned the arm and the leg. What type of injuries, or at least are you seeing your patients for with these?
We're using blood flow resistance training with a lot of patients who have had surgeries on knees and shoulders. We can use it with patients who have osteoarthritis in their knees and hips, also in their shoulders. We're using it with patients who are anticipating that they're going to need a surgery or are trying to avoid surgeries. And what we're able to do is exercise these patients at a lighter resistance and effectively get a muscle response, muscle strength and growth response that we wouldn't be able to get unless we would traditionally use heavy resistance training.
One thing I really found fascinating was you're actually seeing some benefits in other areas other than just the localized area that you're putting the band on, correct?
Yeah, that's correct. So the effect is systemic. It's actually a hormonal effect where there's a cascade of effects that's very complicated to understand, but essentially what happens is the hormones that are necessary for muscle growth are not produced by the body in high enough amounts to grow the muscles unless we're using heavy resistance training. When we put these resistance bands around the arm or leg, we get that same kind of effect.
So if someone thinks that blood flow restrictive training would benefit them, what's the best thing for them to do?
Well, the best thing to do is to discuss it with a physical therapist so that we can verify that it's safe for you to do.
Okay.
One of the things we really don't want people doing is using this stuff without guidance, without supervision. So if you would like to come in and try this as part of physical therapy, contact our clinic at 785-452-6668. You can also discuss it with your physician if you're anticipating needing physical therapy either before or after surgery.
For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.